Yeah. Hey everybody, Dr. Bulow here with Revive Upper Cervical Chiropractic. And today I'm hanging out with Josh.
Hey, Dr.
Yeah, good to see you again. Thanks for coming in. Josh is a patient of ours and he took the time out of his day to come and hang out and chat with us. And because Josh has got a pretty cool story. One thing I will say, and I always forget to say this, Josh, so I'm going to say it now at the beginning of the videos. We're going to be talking about some conditions, in particular with Josh, some injuries to the head and neck, some concussion issues, things like that. It's really important for a couple things. Number one, if you have any questions at all, please ask them, right? Even if this is after the video is recorded, we're live now, but even afterward, you can type it in there. I'll do my best to answer it. If it's for Josh, I'm sure Josh can come by and answer it.
Any questions?
And the other thing is to share it. The thing about this is that this is about healthcare, right? So it's about people's health. You never really do know who in your circle of friends and friends, right, on social media may have some of these issues going on, and we would love to be a resource for them. Even if they're not in the Pittsburgh area, we'll find them a doctor who can help them, okay? So just going into this, that's what we're gonna do. But yeah, let's talk to Josh. Josh, you've been coming under, upper cervical care for how long now? About
maybe 2 months.
Yeah,
I
think that's about right.
2 months, yeah.
And how did you find out about it? What had happened initially? What kind of injury did you have? We'll get to how you found out about upper cervical, but let's talk about that. You had a pretty nasty injury.
Yeah, this happened about 4 years ago. I was getting out of my car. My driveway was a sheet of ice. It was one of those typical Pittsburgh winters where it rained and then then it froze over, and I was getting out of my car and I went to get my 2-year-old son in the back seat.
Yep.
Picked him up, my first step back, and the way I went backwards, and I held him up because I didn't want my 2-year-old to hit his head.
It's crazy.
And I took the full blunt of the fall right in the back of my head.
Yeah.
So
it's intense.
Yeah, it wasn't good.
And it's funny because a lot of people, we were just talking about this, have injuries weeks, months, even years before they see a physician because they think it's just going to go away. So in the balance of time, in 4 years, what had been going on? How, did you try any medications, any other professionals? How did you feel? What had been going on after that? I can imagine, obviously, a lot of pain immediately, but just like what was going on that made you want to look into finding more solutions?
Yeah, actually initially I was fine, and then about 2 weeks later, I went, I had a CT scan, I came back fine, and I was just coming up with little symptoms here and there, but then about 2 weeks later, the floor fell out, and I was having severe panic attacks, emotional problems, and I went to some concussion specialists.
Sure. Yep.
Down in the south side, and they put me through some therapies, and it seemed to work. I wasn't as bad as I was, but there were still some lingering effects.
Yeah.
So they cut me loose, and then I was still having problems with memory loss and some emotional things. So then I started looking online for solutions.
Got it.
And that's when I came across some interviews that you had done.
Oh, how about that? We're doing full circle. Yeah. That's cool.
So that's when I decided to give you a call.
Cool.
And here we are.
It's crazy, the brain is, for most people, I think, this mysterious thing, right? It's a miraculous, powerful organ. It runs your body. That's our approach. We look at the body as being a miracle and just vitally, just infinitely capable. But that's all run by the brain.
Right.
And so it's funny when you look at that, it's like, how in the world do you go from not having symptoms to having panic attacks and blood pressure issues, and some people it's balance issues and obviously headaches. And what I always tell people is that what runs the body, all the critical functions, is not just the brain, but specifically it's the inside center of the brain, the brain stem.
Yep.
And most of the blood flow to that area, what kind of nourishes the brainstem and keeps it really healthy, it's all right up in here in the neck. I mean, they're called the vertebral arteries. They go through the neck and they go up through the opening at the base of the skull, and they're the ones that supply all the blood to the brainstem. Now, the front of your brain here, that oxygen comes through the front of your neck up here. But the actual neck bones are what protect the arteries that go to the brain stem.
Okay.
And right when you hit the back of your head there, the little donut hole space where the brain becomes the spinal cord can get jammed, and that can create pressure, and it can really lead to lingering concussion symptoms And unfortunately, in society, most patients are just labeled, post-concussion syndrome,
Right. Yep.
anxiety, depression, this, I don't know if it's a diagnosis, but the symptom of a mental fog, And it's either medications or counseling or,
Yeah, I actually was following up with a neurologist, and I went to see him once, and he did the full MRI test, and once they came back that everything was
most
negative,
comes back normal or negative.
I could tell he was pretty much just going to cut me loose. Like he
Sure.
he wanted to find if it wasn't on film, if he didn't see it, and then he didn't want to dig in and see what else was going on.
Well, it's the difference between anatomical problems and functional ones. Yeah, if there's nothing there anatomically, a stroke or a tumor or a bleed or an aneurysm, then there's really not much they can do. You can put in medications to regulate brain chemistry, or you can have psychologists and counselors help you process things. But to really maximize your health, that's where the kind of natural approaches of nutrition and chiropractic and upper cervical come in. But anyhow, how did you get up finance? You found us online. That's right.
Yep.
So now the question would be, you come in, just for those of you that don't know, there's also a lot of anxiety around this. You know what I mean? You've been to doctor to doctor to doctor. I mean, it's chiropractic. There's a mixed bag of emotions around that field.
Right.
I like to think it's a lot better now, but there still are some people that think, they're going to crack my bones, or are they real doctors, or that kind of stuff. And we're pretty dang specialized here.
Yeah,
but I know that sometimes exists out there. What was your impressions, just for those that are kind of curious, have an inside look? How was the experience in the first couple of days? And don't toot my horn, but you feel free to be honest. But I'm just curious, for other people curious, what was it like over those first couple of days, and how did you do, and how you been?
Yeah, the first couple of days, and you're pretty typical. You come in, you got to answer some questions to figure out what's going on. And then you did some preliminary paperwork where where you see
Can't
where
get around that.
where you see where you're at what kind of condition you are. So it's kind of like a baseline test, a baseline to see where you're at. And then you get a sitting CAT scan, which was pretty cool.
Pretty awesome. Yeah,
that's a good technology.
We do an advanced 3-dimensional cone beam CT scan, which is a full 3-dimensional rendering of the neck. So we know exactly what's going on when it comes to alignment. When it comes to the alignment of the craniocervical junction, the upper neck, it's really kind of gold standard.
Yeah,
so we did that.
Was top of line.
And then when you came back, how was the adjustment? The upper cervical corrective procedure.
Right.
So again, people have a little anxiety. Are we going to crack my neck? Is it this or that? How did it feel? And how did you feel after the first day, first bit of time? How was the procedure, and how did you do afterwards?
Yeah. There's absolutely no neck cracking per se. It's very scientific. I mean, you're here sitting with a protractor, for heaven's sakes.
That's true.
So he's got the angle
measured,
down.
Everything's calculated.
Yeah, and it's on a drop table, and it's just a simple adjustment. Because of the drop table, you don't feel anything. It's the procedure, and then there's no pain or anything, and then he stabilizes us, and then you go over to another table, and you just relax for 15 minutes with some nice music going. So it's real peaceful.
Yeah, it's a simple thing. It's an impulse that's based on the 3-dimensional imaging, so we can specifically correct it. You rest, and then we like to reassess. We like to reassess to make sure we got measurable change. We're not in the business of hoping it'll work. We're in the business of measuring with baselines. And then how have you been doing since? How was it the first couple of weeks, and how's it been the last couple of months?
The first couple of weeks they've been good. The couple of months, like you talked about during your preliminary, it's the first few months is ups and downs.
A little roller coaster in the beginning. The body's got to figure itself out.
And I'm definitely, I think I'm still in kind of the roller coaster phase. But I have some really good days and still have some bad days. And I can definitely tell now when I put myself out of adjustment, because I'm losing that blood flow pretty much instantly. I'm like, how'd I do that? So
what are some of the symptoms that you notice when your spine is out of alignment, affecting neurology and blood flow? In the profession, we call that a subluxation, but basically, the spine goes out of alignment and starts to mess with that stuff. So what's some of those symptoms that you notice?
I noticed right away that my personality changes. I pretty much go into like a brain fog. It's kind of scary the first few times it happened to me. Like I was perfectly normal for a while, and then it happened, and I kind of felt like I was kind of drunk, actually.
Yeah.
It's kind of like I'm sitting there like, what just happened?
Yeah.
So,
it's wild.
I can kind of tell instantly when it happens.
I think that's so important. That's one of the reasons I wanted to talk with you, is that there's I think a lot of people fall through the cracks like that, where there's nothing structural, or there was and they worked on it, and then they just are dealing with these symptoms that are just unnerving. You just are feeling not like yourself.
Yeah, exactly.
And so we like to just bring people on and chat with them about their experience, let you know that you do have options. We, like Josh said, we always do a complimentary consultation and screening to see kind of if you would be a good candidate for care. If not, we certainly try and help you find someone who can help you. If you're from out of the greater Pittsburgh area, we try and connect you with doctors that do this type of work. And then, so with that said, thanks for joining us. But I'm going to give the last word to Josh. I always try to give the last word to my guests and people I chat with. But any last words that you would use, and just to encourage them or work with them. Let me see one thing. We're getting what is this? Trying to reconnect. You can record a video, but it won't be live. We will let you know if your connection improves and you can start the broadcast live in the same video. We'll let you know if your connection improves and you can start broadcasting live in the same video. So I think we're going to wait. There we are. We're back. We're back. I don't know if you heard me mumbling there, but we lost a connection. But that's all right. We're wrapping it up anyhow. Any words that you would want to say to folks that were in your shoes, or they currently are in the shoes that you were in, that have had injuries, they're looking for help, we'll give you that last word there.
Maybe you've been looking online like I have for years trying to figure out a solution, and you've gone down a rabbit hole and you can't get out of it. I think come see Dr. Ian.
Sure.
You can definitely help. There's a solution out there to your problems. It's not a miracle drug by any means. It takes some time, but there is a solution. Come see him and he'll definitely help.
Awesome. I really appreciate it, Josh. And
really appreciate it.
And I think that's I can't say it much better, but I just have to say that you hit on something I think is really important. You can never doubt or limit what the body can do.
Right.
You know what I mean?
Yeah.
And so that's a perfect way to end. Don't give up. Keep searching. If you have a question to ask them, if you can get out here, you're worth it. And if we can help, we'd love to help. So thanks again, Josh.
Bye, buddy.
Thank you guys for watching.
Thanks so much.
We'll see you next time. Bye now.